I take meds for pain for hip and back that are service connected. Can meds cause Gerd and IBS? Can hypertension be linked to service connected tinnitus? So I think for sure, let's see, can meds cause Gerd? Yes. NSAIDs, anti-inflammatories, more often cause something called gastritis, but there is literature to support a link, and many veterans are connected for Gerd as it relates to orthopedic ailments due to medication use. Hypertension, related to tinnitus, I don't think very many things are related to tinnitus, to be honest, y'all. Migraines, yes, right? Vertigo, yes, to that, and acoustic noise exposure. But the mental health conditions, yes. But all these other things, I don't really believe are that related to tinnitus. Now, if you have a mental health condition that is like in between caused by the tinnitus, then for sure, hypertension we link to mental health conditions a lot. But interestingly, I believe that hypertension can very frequently be linked to orthopedic conditions, right? So due to pain, right? Due to NSAID use, anti-inflammatories can increase blood pressure, right? Can cause problems with the kidneys long-term, right? NSAID use can, which can drive up the blood pressure. And also weight gain, if you've had weight gain due to your hip and back. So that's like pain, weight gain, if it's relevant, and NSAID use, all related to those ortho things. That's just my opinion. Of course, we still got to look at other risk factors. Are you a smoker? Do you have a family history, etc.? I had a CMP exam Tuesday for GERD, secondary to NSAID for patellofemoral syndrome, meniscotomy. It was denied within 9 hours of the exam and posted on the va.gov site as denied. Well, that's unfortunate. I'm sorry to hear that. I would say, like, the first thing I always do is say, like, hey, look at the get your rating decision letter and investigate that document, because that's going to give you a lot of information on what happened. And then you have a lot of different recourse, right? So you can, if you're savvy with the process, there are avenues for veterans to take. As a veteran, this is not me giving advice. I just know as a veteran, because I've filed claims for myself before, the documents are pretty straightforward if you follow the instructions very carefully on how to file your own, if you want to do HLR or add evidence on a supplemental. Or you can hire an amazing, get a VSO, get an agent, or someone to help you with that as well. I'm sorry to hear that, but I always say that the first thing to look at is that rating decision letter and find out what happened. Okay, here's a good question. Good evening. Have you seen IBS and GERD secondary to PTSD because of the medication used to treat the PTSD? So this is a really great question. IBS and GERD, I see very frequently service-connected and rated secondary to PTSD. There are a lot of different factors that go into that, right? So I guess to start off, I think it's important for you guys to know that these two conditions generally will get combined due to something called pyramiding. Again, this is something that an accredited agent should discuss with you, but because they affect the same body system, oftentimes if you're rated for GERD and IBS, they will join it into the same rating, and it'll say something like GERD with IBS or whatever, and it'll be on the same line number. So, I can't say that's always and never type thing. I'm sure if there's a very specific reason why it should be separated, why it should be separated, then it can be, but I just personally have never seen that happen myself. I always see them kind of rated together. So frequently I will see IBS secondary to PTSD. A lot of times it is related to the stress component. So there are medications that can affect both IBS and GERD related, but more so there are some physiologic things that happen. Just stress from having PTSD, anxiety, depression can cause stress on the GI system, and there's a lot of literature to support that. IBS and chronic diarrhea and constipation can be, related, right? So oftentimes I'll even have veterans who are Gulf War veterans that are service connected for PTSD. They'll say, hey, I want to relate this to my Gulf War service. It started in the time period, this and that. And I'm like, okay, that's great. I also may think that you're, based on your responses and your medical history, that PTSD is also a factor. So I'll throw that in there. I always say it's important not to pick one or the other thing, it's important to include all information, whether it's, because these things are multifactorial. So we have to look at all of the positive and the negative factors, right? So if you've got multiple things, multiple theories of connection that are causing these symptoms, we include that, right? And then with GERD, there are some things that can happen physiologically with acid production, with increased stress hormones. And so we see a lot of that overlap as well.